So I'm going to talk to you about Fragile X syndrome. And what that is when in your fMRI gene, there are so many repeats of CGG. And when that happens, you get Fragile X syndrome. When you have about probably 45 or less, you don't have it, so you're good. But when you have probably 45 to 50, 55, it's kind of like gray zone, which is you're getting there. And then you get to around 55 or 50 for 56 to 200. Then you're a carrier, so your children would have it, and maybe your grandkids, but you don't have it. And then you get to 200 and above, you got it, and you get the symptoms of it. And the reason why you get Fragile X syndrome is because your fMRI gene gets shut down from those repeats, and basically it can't make protein because it's in your nerve system pretty much. And how can it process or do its job when it isn't making protein, which it needs? And then some of the syndromes is basically you get intellectual disabilities, behavioral issues and learning challenges, sometimes aggression. The physical features are flat feet, you get large ears, long face, and double jointed fingers, and hyperflexible joints, which I've never seen that, but I'm pretty sure it's gonna look freaky. And males tend to get it more than females because they have one X chromosome and females have two, so for a female it's like their backup plan. They're kind of safer. And there is really no cure for it because it's a mutation, so it kind of just happens. And then, but there are some therapies you can go to. There's special educational therapies, and they kind of treat it like ADHD and stuff. I'm not saying it is ADHD or ADD, but it's kind of like that. And you can take ADD or ADHD medication for it, and that helps. Yeah, and some fun facts is women, they get menopause way before 40, so they get it earlier. And one out of 4,000 men will get it, and then it's 1 in 6,000 women will get it. So I mean, it's not common, but it's still there. And 1 in 260 women are carriers, and 1 in 800 men are carriers, which is kind of weird because women get it less, but there are more carriers of it. So, yeah. And I think that's it.